I sit here today and we listen to these requests for rate increases, I too bemoan the fact that we don't have other players here to address this. The healthcare advocate Ted Doolittle addressed the need to have the hospitals in the room. We are looking at a medical system dominated by two networks, a duopoly. We are looking at, in effect, at only two games in town. And as these gentlemen whom you've questioned before and lady sit here, what ability do they really have to drive those rates? Anyone who's received an explanation of benefits looks at, if you have insurance, this is what the provider billed, this is what they accepted in payment. Yet if you have no health insurance, that same provider will dun you for that full rate. How does that make any sense? We've heard about the private rates underpinning the rates that are paid for Medicare and Medicaid. We will not have a solution until we have all the parties in the room, because you can't address the rates that are being passed down without addressing the rates the providers are demanding, as they are the only games in town, have increasing weight to dictate how much everyone is going to pay. As someone who just a few years ago was buying health insurance on the individual market, I am only too aware of the horror you get when you get that bill before you've reached your deductible. How can you justify $50 for one shot of neosynephrine up a 2-year-old's nose? And I recall that because when my young son stuck a bead up his nose many years ago, that was the rate we were charged. I could have stopped at CVS and picked it up for 99 cents. So again, I think for any kind of solution to this, we need to address not only the rates being asked for by the insurers, but the providers, to look at that duopoly system. In my part of the state that used to be dominated by Yale New Haven Health, Hartford Healthcare is opening facilities, buying up doctors' offices. How can you ever negotiate when you have so little leverage, because these are the only games in town? And let's not get started on the circular firing squad that is the pharmaceutical companies and the health insurers and the hospitals and the PBM managers. We look at performance-based rate making and now in the energy industry. Well, why not look at performance-based rate making the way Medicare does with these insurers? There's one hospital group in the state that participates in Leapfrog that actually has their hospitals and services rated. There's another that doesn't. If I'm looking for good medical care, I'm looking for a hospital group that puts customers first, really enables their staff to do the best job, and sends me home healthy. We have 400,000 people a year who die of unforced medical errors. Why aren't we addressing that? So this is a wide-ranging conversation. I am so happy that we'd had this hearing again this year, but I think Connecticut and its residents deserve everyone to be at the table, and this conversation not just to include insurance companies, but to include the providers, to include the pharmaceutical companies and the PBM managers, because only at looking at all the root causes are we ever going to find the kind of relief our residents need and deserve. And with that, I will conclude my comments.
Thank you, Representative.